Well, just in time for the flu season, our next guest is here to tell us everything we need to know about vaccines. I just had my flu shot yesterday, so this is very timely. I'd like to introduce you to Dr. Brad Lucas, the Chief Medical Officer with Buckeye Health Plan. It's good to see you.
Thank you.
And you know what? I'm glad that we're discussing this. I get my shot every year. I mean, I've got kids. I don't think twice. I just do it because I feel like, it's the right thing to do. A lot of people, some people do not feel that way, and everyone has their right to feel the way they do. But what is it with the flu shot that causes all this?
It's still a challenge. We know that we want pregnant women to have a flu shot, and we know that 50% of them do not.
Right. So you do want pregnant women to get this?
All pregnant women, unless there is an allergy to the gelatin or some of the components that make up the vaccine, and if you're concerned for that, you'd want to talk to your doctor. But all pregnant women, the influenza virus can be very dangerous to babies and pregnant women. Very dangerous.
So as a mom or dad, or even someone that just works with kids, if you don't get this vaccine and you're around them and you get the flu.
Yeah, it's kind of those who get their vaccines are protecting those who do not.
Right.
So recognize when you say, "Oh, I don't get my flu shot," the rest of society is protecting you. Why
don't we talk about some of the misconceptions with these vaccines? Because I think that's maybe why a lot of you maybe stay away. So what are they?
You hear a lot of, I get a cold.
I'm going to get the flu.
Or I'm going to get the flu.
Right.
That's
my arm doesn't even hurt.
That's impossible.
And I had the shot yesterday.
Yeah, and
I'm healthy and I don't have the flu.
It doesn't hurt. There can be some local reaction for some people from some of the ingredients that they put together, like the gelatin to make the vaccine. Again, if you think you have an egg allergy, you might want to talk. You want to talk to your doctor. I remember myself in the past, I would say, oh, gee, I just always get a cold every time I get a flu shot. But there could be just a lot of coincidence. What you have to recognize is it's not association, it's probably just bad coincidence. Not getting influenza is a whole heck of a lot better than any mild side effects of the flu shot. Okay, well, we have, some important information for you at home. Let's talk about who should absolutely get this flu shot. And we're saying everyone, but especially if. Right. Babies don't have, they don't have a developed immune system, so they can't make the response to fight off infection. So the reason we give it to pregnant women is to help the pregnant woman, but that also stimulates an immune response where the antibodies travel to the baby and protect the baby. So we're really getting a 2-for-1 deal there. That's great. Age over 65, I know we all battle with our parents to make sure that our parents get them. Influenza in an older age is deadly. If you are living in a nursing home, if you have chronic disease, asthma, diabetes, sickle cell, so different chronic diseases or problems, you want to talk to your doctor and see if you're one who should have a flu shot. So everybody should get a flu shot. Yes. And age 5 and under, between 6 months and age 5. We want everybody to have a flu shot, but those are the groups that it can be deadly. Okay. Well, we really appreciate all this information, and if you want more information, you can go to BuckeyeHealthPlan.com. Doctor, thank you so much for being here today. Thank you very much. All right.